guys, my name is Mary Kate and I have prepared for you an active learning demonstration for new diabetics on how to properly administer insulin. So this is a simulated learning experience. Since we don't have a patient, we have an orange. And what do we need other than an orange? We need alcohol swabs, we need your insulin, you need your insulin syringe, and you'll also want to know what the doctor ordered for the insulin administration. So first things first, you want to check the blood sugar. Don't administer the insulin if the blood sugar is less than 70. So the blood sugar this morning is 180. So we'll want to take your insulin. This should be stored in the refrigerator if you're not going to use it within 30 days. Most diabetics don't use their insulin within 30 days. So you want to open your alcohol swab and prep this for a few seconds here. Make sure it's clean. You don't want to get an infection. And then you'll open your syringe and you'll want it to be, we said 7 units, so you'll want to get to the 7 on here. You'll take off your cap carefully and you'll put it in the center of the vial and you'll inject it with air, and then you're going to want to draw back 7 units of insulin. And if you have poor vision, you should check with another person, make sure it's the right dose. So we will be doing this on an abdomen if we had a real patient, but since we don't have a real patient, we have an orange. And we'll want to do it at least 2 inches away from the umbilicus or the belly button. So we'll pick our spot, and let's say this is our spot. We would open an alcohol syringe. We have this one though, or alcohol swab. We have this one. So we're gonna swab the site for a few seconds here. And a tip that I give to nursing students is to leave the alcohol swab like this, and you want to point with the arrow, like use this as an arrow of where you're going to administer the insulin. It's just a little tip, especially if you're working with more of a surface area. If you're the patient, you could typically feel it, but if you don't have a lot of feeling there, sometimes it can be challenging to know where you wiped off. So you're going to want to pinch the fat, and if there's not enough fat, you'll do a 45-degree angle, but if there is, you're going to want to go down at a 90-degree angle. You'll hold the syringe in a dart-like motion, and then you'll just go down and inject your 7 units, your finger like this, and you're going to be careful when you take the syringe off, and there's usually a safety mechanism. So for this one, you have this, and you want to hear the click. Once you hear the click, you're going to want to dispose of this properly. You can use a syringe container. Most drugstores sell them. They can be kind of expensive at times though, so you could also use an empty milk jug, laundry detergent, like a hard container. You want to put it in there, and then to dispose of the syringes, you'll just have to find out where your town disposes of them. Sometimes pharmacies take them, sometimes police stations take them, or health departments. It just depends on where you live. So I hope you enjoyed this active learning demonstration video, and have a good day.